It's a caring environment. Anybody coming through the doors feel stress. We're here to help them to settle well. During the journey of any individual through coming for their examination, we try to make them feel comfortable.
I most enjoy actually admitting the patients, because that's when you can kind of sit with them and reassure them. Whether they've had the procedure done 10 times before or it's their first time, it's nice to make them feel calm and support them in that journey. Assisting is also one of my favourite roles, as it's quite a specific skill set that you acquire. So once you start working here, you kind of build up those skills and you become more and more confident as you're taught more, and it's just fun because it's not something that you'd get to do anywhere else.
I really enjoyed the pace of being here. It's quite fast-paced and you are doing quite a lot of different little roles, kind of whether you're head holding or assisting or admitting or in recovery. There's quite a lot of different roles within the job that you can do on a day-to-day basis, which sort of keeps things interesting.
In terms of the endoscopy nurses, there are lots of development opportunities. Some diverge more into the cancer services and counselling patients and helping them through the pathway. Others specialise and become nurse endoscopists, so they're actually doing what traditionally is the doctor's role. So they will perform the procedures, take off small pathology and refer on to us the ones that are a bit too tricky for them. And we are one of the forefronts in the country of that. We've got 11 nurse endoscopists at the moment.
I think it's incredibly important. Here in Norwich, nurses are actually performing 50% of all endoscopy. My job is so patient-focused. I think it's quite rare within nursing to progress your career and keep such a patient-focused role.
We are so fortunate to have this building with all the facilities that we need and all the advanced technology, which is we've got in Norwich, and that's what I am proud of, to manage the unit as a unit manager now, starting from a band 5 in endoscopy unit and now managing this busiest unit in the country.
I enjoy being in a very big team where I work from people with different cultures. So I fit in because we've got people from different parts of the world here, from the doctors, the nurses, and the healthcare assistants.
In endoscopy, we do a lot of things. First is diagnostics. When a patient comes to their GP, they're being referred to us. And when, as my job as a deputy sister, one of those, our job is like when the referral comes through, we see to it that making sure that this patient's referral goes through the right doctors or endoscopists. And then once we have seen them in here, and if there's anything that we have to do, we could do something about it, that is the best thing, that you could do something for the patient.
The first and second procedure I sat in, the patient was quite distressed, and it was really nice to be able to comfort the patient, even though I wasn't kind of doing the procedure. It was really nice to sit with the patient and be able to care for the patient and calm the patient down.
I came here as a band 5 nurse, as a registered nurse, and from that we have band 6, band 7 as well as band 8. Band 8, that is nurse endoscopist. So I think it's a wonderful environment to improve my career.
It's a specialised area, so first they have to get specialised, which is variable in terms of time orientation. They can sidestep into other specialist roles that we work closely with, like colorectal specialist nurses, IBD nurses, and of course there's greater responsibilities to take on as deputy sisters if they want to coordinate and manage the unit in that way.
I knew Norwich quite well, and it was just a nicer place to work compared to London for me. Just the people, just the environment, everything, it just suited me more. Back in London, the travel time from where I lived to the hospital, minimum travel time was about 2 hours, whereas here I live about 15 minutes away.
In endoscopy, you get a lot of one-to-one time with your patients, so you have a little bit of a chance to make a relationship with them, whether that's when you're admitting them, you have sort of 10 minutes, 15 minutes to have a good chat with them and tell them about the procedure, or during the procedure you kind of like help them and look after them and just make sure they're all right. And I think it's like a little snapshot of their journey here, but you kind of have quite a big part in that because it's just you and them for a little while.